Good evening. Thank you for joining us tonight for the Grant County Roundtable conversation on COVID-19 and the COVID-19 vaccine. My name is April Evans, and I'm the Director of Human Resources at Indiana University Kokomo. I will be the moderator this evening. We will begin this evening with Dr. Moore defining COVID-19 and sharing his COVID experience, followed by Dr. Bragg explaining how COVID-19 is diagnosed, treated, and the importance of social distancing now and even after being fully vaccinated.
Good evening, and thank you, April, and thank you, members of the audience. I'm Dr. Moore. I'm the Grant County Health Officer, and with this pandemic, this once-in-a-century pandemic that occurred, the Homeland Security created an emergency management system, and the Health Department was appointed as the incident commander for that, so that I, with a background in OBGYN, have learned much more than I ever thought I would ever want to know about a virus and about a vaccine. And I want to share that with you and help you to understand the virus and help you tonight to make an informed decision. COVID-19 is the coronavirus that was diagnosed in China in December of 2019, and it's the COVID virus, the coronavirus 2019. That describes the disease that occurs. This is a virus that the body has never seen before, that no humans have seen before, so no humans on Earth have immunity to this. It is not particularly close to any, so that you may say get a flu one year, and you may get the flu the next year, and you may have partial immunity to that new flu that comes along. With this COVID, we don't have any partial immunity to it. So it's a novel or new virus. The virus enters the immune system, enters the body through the eyes, nose, and mouth. It's primarily spread by droplets. Can be other ways, but primarily by droplet spread. The virus gets inside of the body and it tricks the cells into thinking that it's like any normal tissue, and attaches to the cells and causes the cell to start replicating the virus. The immune system goes through, and when it detects that there's a strange body in there, the immune system attempts to destroy that virus, and it has a number of ways of doing it. If there were a zombie apocalypse, that kind of thing, where we had a bunch of zombies, there'd be several ways to destroy them. You can drown them, you can chop the head off, you can explode them. Well, the immune system has several ways of dealing with viruses and other germs that attack the body. And so once the body sees it, it will search through its inventory. If it has met this before, there'll be a reserve of antibodies ready to fight it. If not, then the immune system goes about creating antibodies to begin to fight and to destroy this virus. It takes several days to do this, and by the end of 10 days from the time that it begins, then the body usually has eliminated all of the viruses out of the body, except for those who are immune compromised. But the reaction that occurs is usually an inflammatory reaction. And depending on where the body is and where this virus attacks, you get inflammation there. If that inflammation occurs in the lungs, then we'll have primary inflammatory symptoms in the lungs with shortness of breath and difficulty breathing. It could happen, that inflammation in the blood vessels that go to the heart or to the kidneys or to the brain, so that we can get strokes or damages from those, and so that those can go on long after the virus is out of the body. Like with any virus, most of the people who are exposed to this virus do not get infected each time that they are exposed to it. There'll be a percentage that'll be exposed, and based on antibody studies, 4 out of 10 people who develop antibodies never knew that they had symptoms. They're fully capable of spreading this virus to other people, but they don't have symptoms. Another 50% of the people who get this virus may have little or no or mild symptoms that occur. Less than 10% of the people who get it will have moderate symptoms, will get moderately ill, and there'll be less than 1%, perhaps more than as small as 0.1% of the people who are infected with this virus will get it so badly that they may well die. And so you think you got a virus. Is this anything like the flu? In 2019, Indiana had about 185 deaths from the flu all year long. In the first 12 months of the state of Indiana being affected by this COVID virus, there have been 12,000 deaths. So it's much more deadly than that. It's much more infectious than the flu virus. So many of the mechanisms are similar, but it's a much more contagious virus and a much more highly infectious virus that occurred. I mentioned that we got several ways of a zombie that that kind of thing where you get a bunch of zombies coming in that can occur. Well, that sort of thing can happen with the body too. So that if the virus attacks the lungs and then the immune system goes there to try to get rid of that virus, even after the virus is gone, the immune system may continue to stir up and cause issues there, or if it's in the brain or if it's in other parts of the body. So even after that it's gone, we still may get those sort of inflammatory responses that occur. And that may give us a clue to both how it's treated and what the aim of the virus may well be when it occurs. My wife and I were both affected by the virus. We were in that 50% that had mild to moderate symptoms. We did have some. I would have ignored them if there wasn't a COVID going on. But if I were to be honest, I did have symptoms of a cough, and she had some other things. But we recovered, and after 10 days, I didn't have viruses that could affect other people. But it was probably 2.5 or 3 weeks before it occurred. On the other hand, I have a niece early on in this process. In March 26th, she passed away. My family primarily lives in Indianapolis, and she had gone to the hospital several times. They thought she had a cold and then maybe the flu. And finally, when they kept her within 2 weeks, it was in less than that, within about 10 days, the family got a call and we do not resuscitate order. The virus affected her lungs. When it affected her lungs, it reduced her breathing capacity and she became a compromised host. There are several people who are compromised hosts based as we look at this. People who are over 65, 8 out of 10 of the people who die from this virus are over 65. People who have diabetes, hypertension, elevated cholesterol, obesity, lung disease, other sorts of compromising things are at increased risk. If we look nationally, the minority community is overrepresented in people who are hospitalized because of COVID and who die because of COVID. And so that finding a solution for all Americans, for all Hoosiers, for all Americans is important. But it's particularly important because many of the people in the minority community are afraid of the vaccine. And we still may be affected by the virus, but we may be afraid to get the treatment that's there. And so we need to understand that it isn't the vaccine versus a walk in the park. It's vaccine versus several people who are going to go the way that my niece went, maybe the way that I went, maybe the way that my niece went to go. And so we want to talk today to help you to understand what that's about and then what we can do about it. And we're going to ask Dr. Bragg if he could tell us, now that he's in the field, seeing how to treat it, what that's about and what some of the treatment options are. Dr. Bragg.
Thank you, Dr. Moore. My name is Jeff Bragg. I am a family doc here in town. I'm a health board member, work with Dr. Moore in that capacity. Let me just say that it's been a pleasure to work with this impressive group of community leaders to bring you this webinar. And I hope that this is helpful and will stimulate questions and conversation. As we talk more about the virus and the vaccine and the COVID infection, just what Dr. Moore has said, some of the things that make this virus is that influenza that we've dealt with over the decades has an incubation. So that's really when you be exposed to the virus and that symptoms could occur in that time frame. As many of you may know, we are able to diagnose or get positive tests with nasal swabs. We've developed these over time, and we have a rapid swab that can be done, and you get to answer the same day. A more accurate test is the PCR test, and that may take a couple of days, depending on how many tests are being done. The treatment, again, for those that become ill, not the those that become ill, is mostly supportive. It is pushing fluids, rest, over-the-counter anti-fever measures can help people to feel better. As the illness becomes in those individuals where it's more of a problem, most of the time people are seen in the emergency rooms or admitted to the hospital because their oxygen drops. The inflammation that Dr. Moore referenced in the becomes a problem for the body to keep the oxygen level elevated. And so in the hospital, you can be treated with IV fluids, the oxygen supplementation, and then over the months that we've been exposed or that we've been dealing with this virus and this illness, we have found that there are some other more aggressive measures that we can use, and it has helped in those individuals who are compromised and who become more ill. You've maybe heard about those monoclonal antibody treatments, antiviral medications. There was, I think, people have heard about the class of people that have had and recovered from COVID, give blood, and then the antibodies are and plasma is harvested from those individuals as they've donated them, and then that can be used to help those that are acutely ill in the hospital. The idea of the vaccine, as you well know, is it's the way for us to prevent these all the illnesses, but more importantly, the serious ones that send people to our office, emergency room, to the hospital. But it's also one of the main ways that we're going to get back to normal. It's been a long year, as you all know, and this is one of the mainstays of our there are some things that we need to know that after we've been vaccinated, there still will be some changes or things that we've been used to doing. We're still going to the recommendations are still to wear your mask, to social distance, good hand washing, and that we'll do that until a majority of the population is vaccinated. And you think, well, why is that? And that's has to do with we're still learning. It seems like initially it was every day, but now it's weekly or certainly frequently. We're learning more and more about the virus, the illness, and of course the vaccine. And if you are, once you're completely vaccinated, it is still possible that you could have some of the virus that you would be carrying it. And so what they're trying to figure out is that are you contagious still at that point? There is a small group that will get vaccinated that may not make enough or adequate antibodies. And so as we go through this, these next few weeks and months, we'll still do those things that we know that have been helpful up to this point, the masks, the social distancing, until we know more about, are people able to still spread the infection? Is there enough viral load? Even though I've been vaccinated, is there enough viral load that I can pass it on to somebody else? There's be a large number of people that won't be vaccinated yet. We think of school-age kids and the younger folks, because we're working our way towards vaccinating the 16 and older. So those are the reasons that we'll still be doing some of that. How long that'll last, I don't think we know. So that's just some additional information. I think there are some compelling personal testimonies and additional information on the virus and the illness. And so I'm going to pass it on to Adrienne Howard and let her talk to you about her experience. Adrienne?
Hello, my name is Adrienne Howard, and thank you for the invitation to be a part of this seminar. I am a survivor of COVID-19 pneumonia and sepsis. I was diagnosed on December the 1st, and um, my symptoms progressed fairly rapid. Um, I I didn't go to the hospital until December the 4th. Um, and by that time, my cognitive abilities to think straight uh, were disabled. I'll put it that way. My pulse ox was 34 by the time I got to the hospital. And the first thing they asked me when I arrived was, can we put you on a ventilator? But I can tell you the people at Marion General, especially the respiratory therapists, were phenomenal. They did everything they could to prevent putting me on a ventilator, which that did not happen, and I'm so thankful for that. I was obviously admitted to intensive care, which I was in the ICU for 10 days. And some of that experience I don't remember. From what I understand, it's a good thing that I don't. It was touch and go as to whether or not I was going to survive. But I have to say, the doctors and the nurses and all of the providers that, and especially the respiratory therapists that took care of me, it was just a phenomenal experience. I got to the point when they would come in to take my blood gases, I would just put my arm out and let them do it. You just do whatever you can to survive. And part of my experience from having COVID, with the inflammation that you have, my lungs were affected. I have pulmonary fibrosis. That's why I still have oxygen. And also my brain was affected. A lot of COVID patients have this fog that goes along with having COVID. In the very beginning, it was, I felt like a piece of me was missing. I don't feel so much that anymore because my brain is working much better than it was in the beginning. But depression, symptoms of PTSD, those are things that go along with having COVID. And like Dr. Bragg and Dr. Moore said, we don't really know what the long-term effects of having COVID are. I just take one day at a time, and I'm thankful to be where I am now, because I can tell you, I could not see light at the end of the tunnel. Even after being in ICU and then going to rehab, I was in rehab for 8 days after I was in ICU. And then coming home, I still couldn't breathe. I felt like I was running 5 miles at top speed, and still having shortness of breath. And I couldn't do anything. I could do some things for myself, but I needed help. My family was here to help me. They still help me because there's things that I want to do that I can't do because I still have fatigue. The shortness of breath has greatly improved, but I still have to have the oxygen. My goal, I do want to return to work. I don't know if I'll get to return to work, but that is my goal. And the thing is, the COVID affects everyone different. I had the comorbidities, not all of them that Dr. Moore talked about, but I have some of them. And I'm not a spring chicken. I'm 64 years old. And so I just take one day at a time, and I'm thankful for all the care that I received, and I do what I have done everything that my doctors have asked me to do. I exercise. When I first started off, I could only exercise about 3 minutes. I went to exercise. I didn't go yesterday, but I went the day before, and I did 6 miles. I did 4 on the bike and 2 on the arm cycle. So that's an improvement. So exercise is a big part of it. So, but I encourage everyone to get the vaccine, and I plan to get the vaccine the end of March, because I have to wait 90 days after I was diagnosed before I could get the vaccine, because I have antibodies because I've had the COVID. So thank you very much.
Thank you, Adrienne, for sharing your heart, and we are so thankful that you are recovering well. Next, we will hear from Dr. Jeff Breckenridge, who will discuss his COVID experience. He will also discuss how minorities are being vaccinated at lower rates.
Good evening, everyone. I'm going to first of all tell you my experience with COVID. Office staff and I had a patient who made an appointment for a tooth abscess. And lo and behold, when the patient got in the office, it turned out to be a sinus infection, and the teeth were tender because of the sinus infection. And so after being closed into the space with this patient, even with our masks on, I did not wear a face shield to protect my eyes, and COVID can enter your body through your eye tissues. 2 of my nurses caught COVID, and I succumbed to that as well. It was really subtle how I got it. I woke up Friday morning and I couldn't smell my coffee, and I was in a panic. And so I opened up the can and took a whiff of the grounds. I couldn't smell anything. I had a hot cup. I couldn't taste anything. And over the next 2 weeks, I began with coughing and shortness of breath, body aches really bad. But I want to stress one point. Not once did I ever spike a fever. Many of you know that I'm a kidney patient, and I do home hemodialysis 5 days a week, and I take my temperature 5 days a week. Never did my temperature cross 98 degrees. And so I know a lot of times we depend upon these rapid screenings. I went to my eye doctor last week, and the first thing they did was check my temperature. And I just wanted to say, this is worthless, because you can have COVID and not have a fever at all and spread it to other people. I know families who got together at Thanksgiving, and one of the things that they did was check each other's temperature before they came in the house. It meant nothing. I had one family, 5 out of 6 of the family members all got COVID from the youngest sister, brought it into the building. And so get tested. Don't leave it up to guessing. You may think it's a regular cold. It might be a regular cold, but you don't know. And we can't tell from history. This lady thought she had a tooth abscess, and she had COVID-19. And 3 people, and one of my nurses has cancer. And so she was terrified. I got kidney failure. I was on the verge of being terrified. My boss kept asking me, Jeff, you sure you don't want to go to the hospital? And I didn't want any injections because, I got control issues. But God brought me through. I'm back to work. I was seeing patients over the computer while I was sick. And I was one of the people who was fortunate enough not to get deathly ill. But I have lost 5 good friends to COVID-19, and I take it very seriously. In Indiana, majority of our people, particularly the people over 70, are not getting their vaccines. Now, I understand that there is, quote, and a lot of people quote Tuskegee. what I call the Tuskegee effect. This is not 1932, okay? We need to get over a history that was abusive and embrace the new and improved vaccination rules. We have new rules for people to get, that's why you have informed consent. You have to sign a form to be informed of all of the things that are going to happen to you if you get the vaccine. But no one is trying to kill us, okay? If it were, I would not have taken the vaccine, which I did start, and I'm going to have to get a booster again because I was sick in the middle of my vaccination, okay? But only 32% of Caucasian people over 70 have gotten the vaccine in Indiana, and this is at the end of February. And African Americans, only 19% of us over 70 have gotten the vaccine. This is a dismal rate. And the Black Legislative Caucus has presented a treatise to the governor to try to work within our community to meet the people where we're at in senior citizens, living conditions, and senior centers. Gather, we are trying to make it where we can get vaccination. The governor has worked with in the pharmaceutical companies to get Walgreens and CVS on board to giving the vaccine so that places that we normally trod, we can be vaccinated on our normal flight pattern and not have to make a special trip someplace. I know people are limited by transportation, but don't keep you from getting a shot that save your life. Even the Johnson & Johnson immunization, which everybody wants to say is only 69% effective, maybe 72% effective, it is 100% effective at preventing death, okay? No one who got the Johnson & Johnson shot, the single shot, has gotten COVID and died. And if that's what it takes, if you just want a one-time shot, then that is what you should get if you feel comfortable with that. I would have taken the Johnson & Johnson shot. I was not given a choice. Here in Indianapolis at Speedway, they are giving out the Johnson & Johnson shot, and a lot of people are driving all over the city to go there and get that single shot. I want to stress what Dr. Bragg said. After you're immunized, okay, you still need to wear a mask. The CDC and Dr. Fauci have stressed that even though your immunization will protect you from disease, you can still carry live virus in your nose and take it to people who are not vaccinated. And so you can still be a vector to give people disease even though you don't get it. And so we need to do better. We need to stop being afraid of vaccinations. There's no microchip in it. There's no mercury in it. It's not going to rewrite your DNA. It is a safe vaccination that can help save your life. All right. And incidentally, African Americans and Latinos are dying at almost twice the rate as our Caucasian brothers and sisters. And so we need to protect ourselves and stop being paranoid. And I'm be willing at the end to discussion.
Thank you, Dr. Breckenridge. Now we will hear from Cheryl Spikes, adult nurse practitioner, and she will give us information regarding the vaccine and the minority community, and she will also share her COVID experience.
Good evening. My name, as April mentioned, is Cheryl Spikes, and I am nurse practitioner with the Optum program, which is through United Healthcare. And I work in long-term care facilities in Grant County, and my heart is with the residents of long-term care who've been hit hard by COVID-19. Their movements have been restricted and they've been isolated from their families for an entire year now. This started for them last March. The isolation and the lack of movement is affecting residents, both body and mind. I am pleading for them with all of my heart. Working in long-term care facilities, I did everything. I did everything that I could to protect myself from the virus. Everything that they told us to do, leaving my shoes in the garage and spraying them down with Lysol, I did it all. But my reality was that I was infected with the virus in November of 2020. The last thing in the world that I would have wanted to do is to spread the virus to my family. My reality was that my husband was infected with the virus and he became very seriously ill. Sometimes our journey through this life requires us to consider the needs of others, to love others as much as we love ourselves. As has already been mentioned by others on the panel, these vaccines are safe. These vaccines are effective. The latest vaccine approved, the Johnson & Johnson vaccine, is one and done, one and done. And so I can tell you with certainty that God is healing from COVID-19. I know this because he healed me, and he healed me completely. He is on his way to healing others on this panel. Adrian, he's on his way to healing you completely. He healed Dr. Breckenridge. You see him right there. He healed him too. God is healing from COVID-19. I can tell you that God is protecting from COVID-19. I know because he protected my 9-month-old great-granddaughter. She contracted COVID-19 just last month, and she has not had one cough, not one sneeze, no fever, and she ate like a champ. God has protected my 81-year-old father and my 79-year-old mother, both COVID-free and fully vaccinated. I can tell you that God is delivering from this pandemic. If you're making decisions for a resident of a long-term care facility, it's not too late. Vaccines are still being given. It's your choice. Choose deliverance. Choose love for yourself and for others. Choose life, abundant life, just like God promised. Make your appointment as soon as you are eligible. Get your vaccine.
Thank you, Cheryl. Thank you. Now we will hear from Josette DeLuna, who will discuss the importance of the Hispanic community receiving the vaccine and the challenges that language barriers create.
Good evening, everyone. My name is Josette DeLuna. I'm a case manager and outreach and enrollment assistant at Indiana Health Center. I think it's very important to reach out to our Latino community and understand the language barriers that they face. At the moment, there is very little material regarding COVID-19 and the COVID-19 vaccine in Spanish here in Grant County. There is a big portion of our Latino members who do not speak or read English. This is a huge barrier for them. I can tell you that when testing sites first opened up here in Grant County, there was plenty of information regarding them and in the radio, the newspaper, and media, but none of it was in Spanish. We would get calls all the time from our Latino community members asking, where do we go to get tested? What do I need? How much will it cost? There were hesitant to go or call because they feared they would be told or asked something that they would not be able to understand. As Latinos, we are at bigger risk of getting COVID-19. We are a close-knit community and often with big families that live in close quarters, and it's very hard to social distance in these cases. We are also at bigger risk to die of complications due to COVID-19 because as Latinos, we are prone to certain health factors like diabetes, obesity, and hypertension. So it is very important to have this information. Hay que hacer nuestra parte y vacunarnos todos. Thank you.
Thank you, Josette. Next, we will hear from Alex Husky. He will discuss his original hesitations and concerns regarding the vaccine. He'll also share his vaccine journey. After Alex, we will hear from Alicia Hawkins, and she will explain the vaccination process at Marion General Hospital from start to finish.
Thank you, April, and thank you for those of you that are participating tonight. You know, like many others, when I first learned about the COVID vaccine, I was apprehensive. for many of the reasons, as even Dr. Breckenridge mentioned, or even some of the reasons that I heard others mention. The biggest apprehension that I had was, how did we develop this vaccine at such a rapid pace? But as I researched and as I learned the science behind both the virus and I learned the research behind the vaccine, I began to realize that in order for this virus to be controlled, people had to be vaccinated. And instead of being someone who is in denial of getting the vaccine, I had to be a proponent of the vaccine. And so my journey went from not believing in the vaccine to really research that led me to realizing that I needed to be a part of the solution and not a part of the problem. So today I'm proud to say that after much consideration, I have decided to become vaccinated, and I've already received my first dose, waiting to receive my second. I want to encourage all others who may have some doubt, please, please. The research is there. You've heard from members of our panel. Consider the facts, not the fiction, not the myth. Join us in becoming vaccinated. Thank you.
Good evening, everyone. My name is Alicia Hawkins, and I'm a nurse and the Work Solutions Systems Manager at Marion General Hospital. People who are eligible to receive the COVID-19 vaccine at this time are those that are 50 years of age and older, patient-facing healthcare personnel, long-term care facility residents, and first responders. To schedule an appointment to receive your vaccine, you may call 211, or you can go to ourshot.in.gov and complete your registration. Online registration consists of giving your name, your address, your phone number, and answering a few health-related questions. You will be asked to provide insurance information, but it's not necessary. You can click the button that says Proceed Without Insurance. The vaccine is provided free of charge. Once you are registered, you will receive a reminder via email or text about your appointment closer to the date of your vaccination. Please remember to take your photo ID with you to your appointment. Once you arrive at your appointment, you will need to check in with the registration staff and answer a few questions. Those questions would be, are you sick today? Have you ever had a reaction to a vaccine in the past? Have you had any vaccines in the last 2 weeks? Are you allergic to latex? And do you have any health conditions such as diabetes, COPD, chronic kidney failure, or a serious heart condition? After completing your on-site check-in registration, you will be escorted to the vaccination station to receive your vaccine. If it's your first vaccine, you will be given a date to come back to receive your second vaccine within a specific time frame. It's very important that you don't miss your second dose. You'll then wait in an observation area to ensure that you don't experience any side effects. Normal effects that could occur over the next few days after receiving your vaccine could possibly include fatigue, soreness at the injection site, slight fever, and chills. Those are all normal. Some people won't experience any of those. Once your time is up in the observation area and you don't experience any side effects, you are free to go home. You are also given an information sheet on what to do and who to call should you experience any side effects once you're at home. Please remember that the best way to keep you and your loved ones healthy is by wearing a mask, washing your hands, and social distancing. Receiving the vaccine is not a reason to stop wearing your mask, but it is a step in the right direction in keeping our community healthy. Thank you.
Thank you, Alex and Alicia. We will now have comments from our Grant County Sheriff, Reggie Nevels.
Well, thank you, April, and happy Sunday, everyone. Hello, my name is Reggie Nevels, and I am the Sheriff of Grant County. When I was elected, I took an oath to protect and serve the citizens of Grant County. Being a first responder, we were one of the first group in line to get the vaccine. I'm grateful that I'm fully vaccinated, and I'm asking you to take the same oath in order to help us to protect the citizens of Grant County by getting vaccinated. Please help us by placing this virus under arrest. And I thank you for your time.
Thank you, Sheriff. Now, Tanya Smith will share with the panel the questions that may have come in through the chat or through the live YouTube link. Tanya, you're muted.
Thank you. Hi, I'm Tanya Smith, Executive Director of the Minority Health Coalition of Grant County Incorporated. And I have a couple of questions for the doctors, nurses, whoever wanted to answer the questions. The first question is, can a COVID-19 vaccine make me sick with COVID-19?
Dr. Bragg, you want to take that?
The vaccine causes a response that your body where it's making antibodies. So that is really the effect of what a person is feeling with the symptom. There aren't vaccine particles in this they're not virus particles in this vaccine. So you don't get sick with the virus with the vaccine. Anybody else want to add to that?
And I want to support what Dr. Bragg is saying. There are no viral particles in the vaccine. What the vaccine does, and we talked a little bit about the immune system, and if it recognizes it, then it brings antibodies to destroy that. And we've got several different weapons that the body has to deal with that. But what the vaccine does is take a fragment that looks like a portion of the virus, and you build antibodies against that. And when you are exposed to the virus, that portion of the virus, if you get in the community, that portion of the virus draws the antibodies to it, and we do a zombie apocalypse wipeout of that virus based on those antibodies that your body has prepared from the vaccine. The antibodies that your body develops from getting an infection are moderately high. The antibodies that your body develops from the vaccine are 10 times higher than what you'd get if you get an infection, so that you get a higher level of protection. And because these vaccines the antibodies may wane over time, the higher you start, the longer the duration of protection that you have from them, so that no, you will not get it from there. It provides even more protection than getting the natural infection, and it lasts longer. We don't know how long it will last, but it will last longer. Thank you.
I wanted to add also that just because you've had the illness does not mean you're protected for life. Okay. At best, it might be 90 days, but I clearly have at least 4 patients who have had the virus twice, once last March and once again at Thanksgiving. So don't think that if you've been sick, you're good to go forever. You're not. This does not provide that type of protection. The vaccine, as Dr. Moore said, provides 10 times the amount of protection, and that's why you must get vaccinated.
Our next question is Johnson & Johnson available in Grant County?
It will be available. And the answer to that is somewhat convoluted. The health department, the local health department where I am, and Alicia is at the hospital, we speak with the state health department. Some of these vaccines are being channeled through the federal government. The pharmacy programs, for example, and some of the long-term care facilities are coming directly from the federal government to those facilities. So that's a long way of saying that we have partial information. The state will be providing Johnson & Johnson, but it hasn't yet been provided in the county through the health department or through the hospital, but we will be getting it. There's a large dose being given in Indianapolis as they open up their what they call their hit squads. And the state will be providing those in multiple districts throughout where there will be Johnson & Johnson available. For now, you can't really, you may not be able to pick which vaccine you get. If you're in Indianapolis and you go to Motor Speedway this week, you can get Johnson & Johnson. But in our other 92, 91 counties, you may not have that luxury. And it's so important that you be protected. Again, it's not get the vaccine or go for a walk in the park. It's get the vaccine or face some of the things that you've heard the people talk about in this panel that's happened to them and to our loved ones. So Johnson & Johnson is a one and done. And if you can get it, good, but it's more important that you be protected than that you only have that one that's available. Thank you.
The next question, do you have to get vaccinated every year?
I will take that one. So this, Dr. Breckenridge alluded to it in that the immunity will probably wane, and we can see it with natural immunity. And if it does, it probably will wane with the vaccine. Also, that there's variants that are occurring each time the virus goes into somebody, replicates and spreads again. There's an opportunity for there to be a mutation, for there to be a change. And so this is we just finished our first year's experience with this. So we want to be humble enough to say that we don't know everything, but you probably will need a booster because it will fade. But for sure will, if there are variants that are no longer sensitive to this vaccine, you will need that each year. But it's too early to call that right now.
Okay. Next question, will a COVID-19 vaccine alter my DNA?
No, it will not. The particle that's in the vaccine is a strip of messenger RNA from the virus, and your body interprets that and makes proteins that look identical to the virus, but there's no DNA in it. There's no full-blown viral particle. And so it does not rewrite your DNA. The ribosomes that your body has will create proteins that look like the virus. Okay. And so that is how you end up getting the protection without rewriting your DNA.
Our last question, there are no other in the chat. Is it safe for me to get a COVID-19 vaccine if I would like to have a baby one day?
My alley, thank you. This is Dr. Mora, OBGYN, and there was many of the studies that were done. The initial studies, when we didn't know much about it, excluded young children, excluded pregnant women. But some of the women who got vaccinated and were in the midst of these programs did subsequently become pregnant. So we've had a chance to have studied thousands of women who have gotten vaccinated and gotten pregnant with that. Based on that, their experience, but based on just how the vaccine works and how pregnancy works, it does not create a danger for that. Pregnancy is, however, a high risk for, if you get COVID, for getting severe illnesses from it. And we've all seen on the news channels ladies who've gotten pregnant, who've had to deliver earlier, who might have even been in a coma and never got to see their baby for months. And unfortunately, some of them who never recovered from COVID. So pregnancy is clearly a risk factor. The vaccine does protect women from getting it if they haven't had it already, and lets you have a much safer chance of being a mother around to take care of your baby.
And that's it. That was in the chat for questions. We thank all of you who have been able to answer the questions, and we thank you those who had questions to ask. April.
Thank you so much, Tanya. And thank you to all of the viewers for spending their Sunday evening with us, discussing COVID-19 and the importance of receiving the vaccine. I would like to also thank these very distinguished members of our panel today for giving of their time and their expertise to the community. I am fully vaccinated.
I am in process of my vaccination. I've had my first shot.
I have had my first shot and I am a survivor, just as you will be one. So please, please love yourself and love your family. Become a member of our group. Become vaccinated. This is too important not to.
I am fully vaccinated.
I am going to be vaccinated at the end of March because I had to wait 90 days after I was diagnosed with COVID. But I plan to be fully vaccinated, and I encourage everyone to do the same.
I got my first vaccination on January 4th. I tested positive for COVID on January the 8th. I got my repeat shot on January 25th, so I think I'm going to need a booster later on. So I'll probably have to get the Johnson & Johnson just to give it a kick in the pants.
I am fully vaccinated.
I had COVID in December, so I am waiting my 90 days, but I am scheduled to get my first vaccine.
I have had my first vaccine and will receive my second vaccine soon.
I am fully vaccinated.
And I am fully vaccinated.
Dr. Moore, and I am fully vaccinated. And hopefully after hearing this panel and having an opportunity to look at the issues and ask them and think about you, it's not just about you, it's about your community, and encourage all of us to become fully vaccinated. Thank you for joining us tonight.